Hello, my name is Kira Devlin, and I'm going to be presenting on the disease cholera. So, cholera's scientific name is Vibrio cholerae, and another nickname for it is the Blue Death. This is because in London epidemics in the 1800s, it was very common for patients to turn a shade of bluish gray due to dehydration and oxygen loss. But today, the World Health Organization estimates 1.4 to 4 million cases and 43,000 to 123,000 deaths per year. And cholera is still endemic in Asia, Central and Latin America, and Sub-Saharan Africa. So cholera is from the genus Vibrio, and Vibrio are usually comma-shaped motile rods. They usually live in aquatic environments in association with other eukaryotes. They can be anywhere from mutualistic to pathogenic. Cholera is obviously one of the more pathogenic ones. There's over 200 serogroups of cholera, but only the O1 serogroup is linked to the cholera pandemics, and that serogroup has two serotypes, Inaba and Agawa. Fun fact, so it was the cholera epidemics in the 1800s that actually helped found epidemiology through the scientist and physician John Snow. He linked the spread of cholera to a water pump and not bad air, which was the predominant theory for a long time, and he studied cholera outbreaks and how to control them in London in the 1800s, and that's a picture of the water pump that he linked with the epidemic of cholera. So cholera is spread fecally orally through contaminated water. So human waste gets in the water in countries with poor sanitation, and then human waste remains infected, or a human infected with cholera, their waste has infectious bacteria for up to 5 days after secreted. So it'll sit in the water, it'll grow, and then other people will come and drink it. And if it can incubate anywhere from 12 hours to 5 days within a person, and half of severe cholera patients are going to die very quickly if not treated right away, and that's because of severe dehydration. All right, so the port of entry is the mucous lining of the small intestine. And in order for cholera to even get into the small intestine, it first has to get through the gastric enzymes of the stomach, and the stomach does kill most of the bacteria. But whatever gets through, it will penetrate the lining of the small intestine, and then it will attach to the microvilli. And as soon as it attaches, the flagella will detach, and that flagella detachment causes or triggers 2-subunit cholera toxin, which is the little purple and red toxin in the figure on the left. And cholera toxin has 2 subunits, subunit A and B. Subunit B is going to bind to the lining of the small intestine, and subunit A is going to trigger a cascade of different chemical reactions that will result in the efflux of electrolytes and fluid out of the intestines. So all these chloride ions, mostly, and other ions as well as water, will rapidly be secreted out of the intestines, and this creates very watery diarrhea, which is the main cause of death with cholera, is because all this diarrhea, people become dehydrated and they will quickly die if they're left untreated or not rehydrated right away. So the predominant symptom for cholera is very watery diarrhea or rice water stools. This just means stool that looks like it's been used to rinse rice because it contains the lining of the intestine and all the ions. It also contains the normal microbiome of the small intestine. Because of all the ions and water rapidly going through it, it will take off the lining of the normal microbiome in the small intestine. Also vomiting and dehydration, signs of dehydration, sunken mouth, dry eyes, rapid pulse, cold skin, crumpled feet and hands. So an adult cholera patient can produce up to 1 liter per hour of loose watery stools, which can lead to hypovolemia, which means that the liquid portion of your blood is too low. So this causes the body to start to shut down. This leads to shock and death. So like I said, if not treated, half of severe cholera patients will die very quickly. And for children, the rate of excretion is between 10 and 20 milliliters per kilogram per hour. And cholera is actually more common in children less than 5 because their immune systems are weaker. So the immune response, as cholera gets past the stomach and adheres to the mucus layer of the small intestine, there's going to be antigen presentation on Peyer's patches, which are lymph nodes within the small intestine. Then there's going to be an influx of B cells, and the B cells are going to start secreting antibodies. And this diagram on the left is from a study of the immune response of cholera and some different antibodies. So some antibodies will bind to the cholera toxin, and some antibodies will bind to the surface of the cholera bacteria. So the one on the top, IgG and IgA bind to the cholera toxin, and those will inhibit it from binding onto the surface of the small intestine, and then IgA, IgG, and IgM can bind to the O-specific polysaccharides of the bacteria themselves. And these antibodies are far more effective, the study found. So letters C and D on the bottom of the diagram show two different possible mechanisms for why it's so effective. C shows agglutination and D shows motility inhibition. And then a person who has cholera and survives, natural cholera is a very good defense. This is because the memory's B cells. The cholera vaccine is also critical for new outbreaks and epidemics because it will trigger these antibodies to start being formed. So cholera is endemic in poor countries, so usually there isn't sufficient laboratory equipment to properly culture and determine that it is cholera that's causing an infection. So it's usually diagnosed by clinical signs and symptoms. This includes signs of dehydration, vomiting, diarrhea, very raspy and deep breathing. The photo on the left shows a sample of the kind of rice water stools, which is the hallmark of a cholera infection. So this is a flow chart of a person who comes in a poor country to a hospital with severe diarrhea and how they're assessed, depending on dehydration. Obviously, if they have severe dehydration, they're going to test them for cholera with a rectal swab or PCR or whatever equipment is available. And then if it's mild to moderate, they're treated either with just oral rehydration solution or IV solution, and they're left to stay for a certain amount of time. So treatment for cholera, the most predominant treatment is oral rehydration solution. So this is sodium chloride, potassium citrate, and anhydrous glucose mixed in 100,000 or 1,000 milliliters of sterile water. And the amount of oral rehydration solution given to a person is determined on their age, body weight, etc. So after each watery stool, ORS is given to control the fluid within the body. And if that doesn't work, or if a patient is severely getting worse, they'll use IV fluid, which basically just has a higher concentration of ions and of fluid and can instantly replace the fluid lost through watery stools. There's also different antibiotics you can see down below that are used. However, antibiotic resistance to cholera is a global concern because within these countries where cholera is endemic, it's very common for people to do frequent and incomplete courses of antibiotics. So patients within a hospital, the World Health Organization requires that they be given IV fluid and antibiotics. You can see a picture on the right in Haiti, and they're lying on what's called a cholera cot, which basically has a hole and a bucket underneath, so the exact amount of fluid that is lost can be replaced for each patient. So the oral cholera vaccine is critical for people with cholera. If it's implemented early in an outbreak, it gives 79% protection to a population. And water sanitation, and hygiene is also critical. So safe water storage, chlorination of household water, washing hands before eating, all these things are linked to stop the spread of cholera, and the World Health Organization tries to educate populations in countries where cholera is endemic and where they see outbreaks starting to occur. The trouble with the oral cholera vaccination is getting 2 doses to people within 14 days. Cholera is prevalent in rural areas, so this can be very challenging. Other ways of protecting people from cholera, breast milk actually protects because the sugars in the breast milk can interfere with the adhesion of the cholera bacteria to the small intestine. So mothers are encouraged to breastfeed their children for longer amounts of time in poorer countries because it helps the children's immune system. Zinc also is good at preventing cholera and any gastrointestinal pathogen because it um, uh, supports the lining of the epithelial cells and increases the absorption of water and electrolytes. Future outlook. So there's lots of studies going on with cholera right now about different treatments to help combat antibiotic resistance. The picture on the right is from Wayne State, who they just received a grant to study the evolution of cholera. The World Health Organization has set a goal to eliminate cholera completely by 2030. And then you can see this, the figure on the left is the distribution of cholera from 2016 to 2019. It predominantly remains in China, India, and in Africa. Thank you.